The president's coronavirus task force, he's got some of the best and brightest on it, including the administrator for the Centers for Medicare and Medicaid Services, Seema Verma. He speaks very highly of her. Watch this.
I want to especially thank Seema, the administrator of the Centers for Medicare and Medicaid Services. A wonderful job she's doing, and definitely a complex job, but you have it under control, right?
Sitting right next to the president there, and yes, that is a great big complex job you have. Seema Verma, welcome to Newsmax.
Thanks for having me.
So I understand that you are very concerned about the nursing home situation. We all are. Latest figures indicate something close to 30% of the fatalities may have happened at nursing homes, 30,000 or so. Americans are very, very concerned. We got 153,000 cases. How is the administration tackling this?
Well, let me just say from day one, President Trump has shown strong leadership and understanding that nursing homes were going to be stressed by this situation. You know, we're talking about an unprecedented situation where you have a virus that attacks those elderly individuals with underlying health conditions living in close quarters with a very contagious virus. That's why the president took action early on. You know, we doubled down on infection control guidelines. We put those out to nursing homes and all healthcare systems across the country. And we followed up, you know, pretty much every couple of weeks. We've been using the latest data and science from our surveys of nursing homes and the CDC investigations of nursing homes to update our guidelines. We've also called for transparency so that patients and their families have a better understanding of what's going on in nursing homes, and they know if there's coronavirus inside the nursing home. And then the president has called on all of the nation's inspectors to go into nursing homes to make sure that they're adhering to those federal guidelines. At the end of the day, this is a federal-state partnership, and the governors are boots on the ground, and we've appreciated the strong leadership that we've seen from many governors, whether it's testing their nursing homes, using the National Guard to clean their nursing homes, and to also focus on inspections.
How many nursing homes are under federal care, or does the federal government own? Are there any? I know they're state and they're private, but does the federal government have direct control? Are there any federal nursing home facilities?
Well, the VA has some nursing homes, but in terms of my agency, the Centers for Medicare and Medicaid Services, we set the federal guidelines of safety and quality. And then we work with the states to inspect these nursing homes to make sure they're adhering to those guidelines. But ultimately, states license these facilities. What the federal government can do if a nursing home isn't compliant is we can withhold their reimbursement from Medicare or Medicaid. But the states can, they have the authority to license the facility in the state.
And when we talk about reopening, these nursing homes, they didn't shut down. They were just closed to visitors, correct? I mean, not many actually closed down. Is that what you're talking about in terms of reopening?
That's exactly it. And that was a very heartbreaking decision that we had to make. But we wanted to make sure that we were doing everything we could to keep nursing home residents safe and protected from this virus. That being said, we know that families and nursing home residents are anxious to reunite because they haven't seen each other in a very long time. And that's been very, very hard for our nursing home residents. The nursing home reopening guidelines are guidelines for state and local officials about how they can reopen those facilities. So we're calling on nursing homes to test all of the residents and also their staff, and they need to repeat that testing for their healthcare workers. We're also calling on states to assess the situation on the ground, to look at the number of cases in the community, and to also assess that particular nursing home. Have they had outbreaks? You know, are they able to adhere to those federal standards to ensure that our nursing home residents are safe?
I have to jump in very briefly. I know it's a state issue, but I'm sure you're familiar with the policy here in New York that sent COVID positive patients back into nursing homes. There's concern that this led to many, many more deaths. Are you aware of this situation, and is there anything you can do about it?
Well, from the federal level, our guidelines are very clear that when hospitals are discharging patients, they have to make sure that they're discharging a patient to a place that can address their needs. So whether that patient is going home, they need to make sure that that environment is suitable to address the patient's need, or to the nursing home. So federal guidelines are very clear about discharge planning. That being said, we've seen governors across the country set up COVID positive facilities so that they ensured that individuals that were coming out of the hospital, they were still testing positive, they just needed a place to recover. Some states have set up facilities that were able to accommodate those needs, because sometimes nursing homes did struggle with being able to address the needs of somebody who's COVID positive. Sometimes they may just not be able to isolate patients appropriately. All
right. Administrator Verma, I'm afraid we have to go, but thank you very much. Seema Verma from the Centers for Medicare and Medicaid Services. Good luck to you. Big job. Thanks so much.
My pleasure. Thanks for having me.
All right. You bet. You bet.